lab for the year, and one of the areas of focus for Scholar Skill Labs is emerging health policy issues or developments. And so, given the impending election, we wanted to dedicate our first skills lab to the election and implications for health policy. So with that said, we are really fortunate to have Dr. Mark McClellan, Director of the Margolis Center, here tonight to give us a better sense of the candidates' health policy positions and where healthcare reform might be headed moving forward. So without further ado, Dr. McClellan, do you want to give us a quick introduction of yourself, and then you can just take it away from there.
Yeah, hey, thanks, Risha, and thanks to Karina for helping to set this up and put together the slides and the presentation, and thanks in advance to all of you. You're going to get to do the work for the last half of this session. But also special thanks just for being in the program. I see a number of familiar faces. Some of you I have not met before. Welcome back to all of you to the new virtual edition of the Scholars Program. We're learning along the way with all of you, but I think one silver lining is it makes it easier in some ways to get together with me, with other speakers, people you may not see as regularly. So we're looking forward to your suggestions about how we make the most out of these opportunities for interaction, because there's certainly a lot going on where the center is involved in current politics and COVID response and lots of other activities that we'd like you to be very much a part of in these really distinct and extraordinary times for both education and health policy. So I'm going to try to share my screen. Now while I'm doing that, I think Risha may need to enable something here.
Okay. Let's see. Okay. See if you can share now.
Yeah, there we go. Now I just give you like the right to talk. This is the question. I give you like my other presentation. Let's see, does this look right? So you guys, what are you seeing now? Slide deck, I hope?
Scholar Skill Lab.
Perfect. All right, it's even the right one. So, like many of you, I started out in college and graduate school not really knowing what the hell I wanted to do. I ended up in health policy kind of by accident. A lot of people in my family were involved in politics in one way or another. My mom was the first first female mayor of Austin. She did as a single parent of 4 teenage and younger boys, so that was kind of an interesting experience growing up. Kind of made me think that I think I'll just go into medicine or something a bit calmer than that. But kind of one thing led to another. I ended up doing a PhD alongside my MD in economics. I got interested in that because the work that we did, the models that we were studying, really seemed to have some important implications for how what people were and weren't able to do. The financing matters. It's certainly not the only thing that matters. There are lots of other fields you can combine with medicine or combine with health policy. But I think what's most important for me was a couple of things. One is going into medicine, really, you have to get in there with people at some of the toughest times and toughest situations that they and their loved ones are dealing with in their lives. And for those of you who like interacting with people and care about what happens to them, healthcare in a wide variety of areas, and many of you are involved in, is a great opportunity to do that. Nothing matters more to people than their health and well-being and that of their loved ones. So you're automatically working on issues that really matter. And I think the second thing is to try to combine that with, whatever your, I don't want to say superpowers, but whatever your skill sets are, that can help you bring some distinct insights into that. So whether it's in law, ethics, engineering, other technical aspects of medicine, you can bring that to bear on health policy problems. And what we're really trying to encompass here in the Margolis Scholars Program is showing how for these very complicated issues, bring together a commitment to health and well-being for everyone, with some technical skills around medicine or other skill sets that are useful for making informed policy decisions, can lead you to a really interesting career. My path was completely non-linear. You know, I wasn't intending to do a PhD in economics. I only took a job in econ because I kind of had been asked to leave the neuroscience lab I was working in, as I wasn't doing a very good job, and I needed some way to pay for graduate education. I knew a bit about statistics. Knowing statistics, by the way, knowing how to write, those are also really important skills in anything, particularly in health policy. And you know, similarly, my career path was non-linear too. But the nice thing about working in healthcare and health reform is, for reasons I'll show you, I think it's always going to be with us. It's certainly with us in the 2020 election, which is what I'm going to focus on now, even though it's probably not going to play out in the same way that people had expected. Is going to be very important, though. So this is a long-standing political issue. And by the way, I have time to come back and talk more about, you know, personal perspectives on all of this and things like that today. You know, I'm around on Zoom. Let me know if you want to if you want to talk more. So the typical way that healthcare has come into political debates and concerns is around rising costs. Why are costs going up? Well, prices are going up to some extent, but also capabilities are going up. We got way more drugs, way more medical technologies, way more that we can do for people than ever before. Plus, we've got a population that's aging and that is not doing so well on managing many of its risk factors. So for a lot of reasons, healthcare costs have been rising. This was a pre-COVID chart, obviously. There was a big dip in healthcare spending in 2020, but projected to be back on track after that and continue to go up as a share of people's out-of-pocket payments. They see this every day, especially for drugs, where as opposed to like hospital payments, where once you kind of hit a cap, if you're lucky enough to have decent insurance, you're not paying any more. That's not the way that most drug insurance works today. And it's also important because you can't really do anything in public policy without paying attention to healthcare spending. So for those of you who have been in my classes before, you've seen this chart. There are three things that the federal government spends money on: Social Security, which is about 5% of our GDP and getting bigger as our population ages; our healthcare programs, Medicare, Medicaid, the Affordable Care Act exchanges, children's health insurance program, military health, and so forth. That's another now 5 or 6% and growing of GDP. And this is where all the growth is projected to occur, because again, healthcare spending is going up. Our population's aging, so not surprising that that's happening. And everything else, defense spending, spending on all the social factors that influence health outcomes, infrastructure, education, low-income assistance, WIC, all of that stuff, that's in the blue area, everything else. So this is why healthcare is unquestionably are going to be, for, you know, at least until we figure out a low-cost cure for everything, a big issue for all of us in every election. And even more concerning is we're spending more on healthcare. We have more technical capabilities than ever before, but our outcomes are getting worse. So this is overall U.S. showing that the southern parts of the U.S. historically have done worse than other parts, like the Northeast and West. But kind of across the board, there's been first a leveling off of life expectancy, and in the last few years, actually a decline. And we don't have the statistics out for 2020 yet, but this has gotten worse. The health outcomes are getting worse with the very high rate of COVID infection and death in this country compared to others. It's now the number 3 cause of death in the United States this year, and that's not even taking account of all of the associated disability deaths, morbidity, and mortality that are coming because of reduced access to many healthcare services. So this is a reminder, there are different ways that people get insurance to help them with their costs. It's intended to help improve outcomes and make the care that you need more affordable. About half of Americans, a little bit less, get insurance through the their employer. The next biggest group is Medicare and Medicaid, the two big public insurance programs. With Medicare is about 14% of the total. It's like 1 in 7 individuals. That's going to go up to like 1 in 5 over the next 20 years with retirement of the baby boom, and those people are particularly expensive. Medicaid covers a huge number of people, 3 main groups, as you all probably know: children and single moms with low incomes. That's traditionally what's been covered, and what's covered in states like North Carolina that haven't expanded. Also, people who are low income and eligible for Medicare, so-called dual eligibles. That's people over 65 with low incomes, people with long-term disabilities who are on Medicare as well as Medicaid. And then in the states that have expanded Medicare under the Affordable Care Act, childless adults with incomes up to 150, 180% of the poverty level, and that varies across states. Also a small share of these individuals, the 6%, that's the Obamacare exchanges. So we spend an awful lot of time talking about that. It's very important for the people who don't have good coverage options through their jobs and aren't otherwise eligible for Medicare or Medicaid, but it's a relatively small part of the overall total, and we're at about, I think now we're up to probably up closer to 10% uninsured rather than 9%. So given all these concerns about costs, given all these concerns about quality of care and access to care, not surprising that this has historically been one, if not the leading issue in elections. Elections are usually about, in recent years, have been mainly about 2 big issues. One is how well the economy is doing, and typically the Republican candidates poll better and do better on that. And the other is healthcare and affordability of care and related issues like drug pricing and the like. And when that issue tends to get prioritized, Democratic candidates tend to do better, and you can kind of see that in how party voters break down. And depending on how things are going with the economy, other issues as well, that the independent voters may shift one way or the other. That's kind of a typical election. 2020 is not going to be a typical election. So if you look at what's the most important issue now, this has been a really big shift. Where is healthcare on this list? Down, way down. So it's behind the economy. Okay, that's not surprising. We're in the middle of probably a depression. It's way behind COVID. COVID particularly important for Democratic voters and to some extent independent, but independents still ranking economy #1, but it's related to COVID, but also below criminal justice and policing, race relations, which is coming directly out of the George Floyd and other issues that have put issues related to racism and equity much higher on the political agenda than they've been in the past. The criminal justice and policing, you need to think about how you interpret that. A lot of Republicans are ranking that issue high, not because they think that police need to be, we need decriminalization and fundamental reform in police forces, but because of concerns about law and order and protection in their neighborhoods. And we have a big issue with suburban voters, particularly this year. You all have seen all the ads on TV related to that. Immigration up there too, usually not that high of an issue. It's not as high as healthcare, but this is like way down for healthcare than was the case in previous elections. So what that means most likely is you're not going to see a whole lot of attention, a whole lot of detail on the healthcare proposals because that's not the main thing that people are voting on. ACA support, it's gone up and down. Basically, the more that Republicans are in office and taking steps towards undermining it, the more popular it gets. The more that Republicans are out and Democrats are implementing and people think things are going wrong or taking it for granted, the less popular it gets. And this in contrast to, it's been interesting, in contrast to most every other program that's been established as a federal entitlement in healthcare. The rest of them have become pretty bipartisan. Obviously Medicare and Medicaid, Medicaid expansion, okay, still kind of controversial, but not Medicaid as a core program itself. And even like Medicare Part D, it started out more, as a competitive approach to doing drug benefits, started out more as primarily Republican backed, but it's got bipartisan strong support now. Just people talking about how do we tweak it to make it cover more stuff and maybe do it at a lower cost. But you have to have caution in approaching that and criticizing it. ACA has been continued to be a pretty partisan issue, and it's coming back because of the recent developments with Ruth Bader Ginsburg's death. Republicans, again, historically have really opposed the ACA, but you can see that green, which was like high in 2016, helped get Trump elected. As soon as the Republicans actually tried to repeal, you all may remember back in 2017, popularity of the ACA went up, support for repeal went down, and that's not even high, at least heading into this election season, wasn't even high on the list of Republican goals. Much more important, things like healthcare costs, not having a single payer approach, doing something about drug pricing, things like that. And I would say that I know among many of our students, we've got some supporters of single payer, we've got supporters of everything. This has been a tough one. It's been a tough one to get broad support in the public for. It's been a tough one to find a way to finance even states like Vermont and California that have made a go of it. So especially since the election is not really going to be about healthcare, if it had been Sanders who won and we're going to do a better job on COVID than we are doing now, maybe it would have been different. But this is not something that single payer is not something that Biden has really has supported at all, and so not probably a live issue for this season. Now, Karina put together a nice summary of some of the key positions of the candidates on the big health policy issues. I'm not going to go through all these in detail, but feel free to take a look. And I know many of you all are following this as well. I'd say with Trump, Trump is not trying to run to win on healthcare issues. He's trying to run to win on the economy and bringing the economy back from the pandemic. He has felt vulnerable on healthcare issues. So you've seen over the last few weeks a raft of pretty unprecedented executive order proposals to do things that I don't think the federal government, or at least the executive branch, has the authority to do. So one of them, for example, 2 weeks ago was an executive order stating that it was the sense of the president that there should be no prohibitions on coverage related to pre-existing conditions. Well, that's a nice statement, but unless you have like a regulatory path under current law to implement that, it's not possible to do. The only law that we have that enables no exclusions based on pre-existing conditions right now is the ACA, which is something that the president has opposed. Similarly, there have been some proposals related to a so-called international pricing index for drugs, which again, not an easy path towards implementation without congressional action, and proposals related to other aspects of surprise billing, other issues that people are concerned about, but really not a pathway to implementation. And these are recent proposals, so not clear what's going to actually happen to them, since in general they're not going to be feasible to implement until after the election. Yes, one exception to that is states, if they want to, can now have a pathway to import drugs from Canada, though I'm not sure any states really taking that up yet besides Florida. That's an important one for the election, I guess. On Biden's side, so he had a big group of experts, including and supporters, including from the progressive wing, if you want to call it that, and the more moderate wing, if you want to call it that, of the party, that came together, worked on a whole set of platform proposals for the campaign that resulted in a set of steps, including those described here. Strengthen the ACA, make it easier perhaps for states to expand Medicaid, something that states in a difficult economic environment are really not super keen on doing given the tight budgets they face. Have a public option, so enrolling in Medicare all the way down to age 60, sort of the now kind of more widespread supported Democratic proposals on drug pricing, which is kind of a version of an international price index that will be implemented legislatively. We can talk about this some other time, but people in my class last year know that it's not really a negotiation proposal. It's really just, you can be either in the US market or not based on whether your price is within this range coming from reference prices in other countries. It's not like the usual negotiation over drug prices, which comes with things like setting up a formulary and having some ability to walk away if the drug manufacturer sets the price too high. Americans have been really reluctant about anything that smacks of restrictions on access, or you remember the old death squads and so forth. It's gotten in the way of having like a more reasonable discussion about, are these drugs really worth the price, and can we negotiate more aggressively if we're concerned that they're not. So this is a somewhat different approach, but those are all part of the package. Also, as I'll get to in a second, a lot of emphasis on COVID-19 response. So the ACA is interesting in light of I guess we'll come back to it in light of the unfortunate death of Ruth Bader Ginsburg. Much more live issue because of the lawsuit. The administration's been against it for the whole time of the administration, but since the effort to repeal the ACA fell short, thanks to John McCain in 2017, and I showed you what happened in terms of popularity of the Republicans' position on the ACA, even among Republicans, and the 2018 midterm, where the Democrats picked up a lot of seats running on exactly this issue, the repeal of pre-existing conditions, the repeal of the expansions in coverage, have not really pushed that much. On the Biden side, basically expand the ACA, bigger subsidies to higher income levels, make the coverage more generous, pay for it with savings and drug costs, things like that. Medicaid expansion, kind of similar differences. Just going to try to move along here a little bit. Medicare, neither side is really wanted to touch Medicare. In past elections, I showed you that chart earlier about where the money goes in the federal government. I mean, the bulk of it goes to Social Security and Medicare, and those are getting bigger. And in past administrations, Republican candidates and Republican presidents have had efforts intended to limit Medicare costs. They've generally never been successful. One of the rules of politics over the last 40 years has been that healthcare programs beat other programs in terms of prioritizing. So Medicare's an entitlement, Medicaid's an entitlement, access to a guaranteed income, a minimum wage, social services support. Those are all so-called discretionary type spending or proposals that are not kind of built in as entitlements. So healthcare tends to win, and President Trump kind of has this populistry, has a very popular, or relatively popular, I should say, with the basically the older you get, the better he does. So has not proposed anything, any kind of cuts or so forth, at least directly. And we talk about the expansion, the public option expansion for Biden. And both of these candidates have surprisingly similar conceptual proposals on reducing drug prices, kind of leveraging the fact that Americans are really ticked off that they're paying a lot more for brand name drugs than people anywhere else in the world. And it's visible to them because they pay for a lot of these costs out of pocket, the way that drug benefits are designed. So proposals to create more of this international pricing index. There's a lot of other stuff there too, but that's the one that gets the most attention. and some ideas around transparency on pricing, competition. These are all alternative payment models. This is all stuff that people like us who are working on reforms to make healthcare work better and cheaper and deliver more value find it really important. They tend to get lost in the campaign rhetoric because there's some element of support on both sides, so they're not as clean differentiating issues. Everybody's for more value conceptually, have a kind of more of a bipartisan flavor to them. So you tend to hear less about them during campaigns. And to the extent that people are focusing on these issues like surprise medical bills, helping people get care at home, using telehealth where it's better, tends to be bipartisan support for all of those. Now, as I said, COVID really upset the usual approaches to politics. And I talked earlier about the really unfortunate events that fortunately have gotten a lot of national attention related to structural racism and what to do about it. Those are more divisive than you might think, being on campus at Duke, in terms of public opinion about the path forward there. Just look at how different the campaign ads are related to protests and equity, and how Vice President Biden has gone way out of his way to say, I am a law and order guy too, not for looting or anything like that, but we have to find a way to bring the temperature down. So he's trying to manage what's still a very complicated issue for Americans. And on top of that, with Ruth Bader Ginsburg's death, there is a real concern about what happens to the ACA. So COVID is the big healthcare issue for 2020, and basically on the Biden side, you see a very comprehensive plan. We're going to have lots of access to testing. We're going to cover all COVID-related costs. We're going to have a science-based approach to vaccine and treatment development and so forth. For Trump, he does talk about these issues. He particularly likes focusing on vaccines, as you've seen, because that's kind of the eventual probably best path out of this. But to the extent that people are thinking and talking about COVID, that's not really what he'd like the election to focus on. So unfortunately, that does translate, it has, at least in this case, translated into some steps that I find personally really concerning. Just had another 2 op-eds in the last 2 days about this, around the importance of backing sort of science-based approaches to how we prevent and develop treatments for COVID-19, and the need for much more federal support for we're a federal state system where a lot of the activity that is undertaken to address public health emergency occurs through the states, but really need systematic support for all of that to get a good public health emergency response, and that just hasn't happened as much. But again, I think deep down there's some significant political foundation for it, as described. So the last issue that's come up recently, and then I'm going to stop in the next 1 minute or so and turn this over to Karina, is the future of the ACA. I think that most people believe that this law with Ginsburg on the court was headed for this additional appeal. This is going to, the oral arguments are going to be heard the week after the election. This is the 3rd time back in some form to the Supreme Court. For those of you who are following, as you know, the original case that the Supreme Court decided with Chief Justice Roberts, casting an important vote and writing the opinion, basically said that, look, the federal government, the Constitution does not provide a mechanism for a mandate for everyone to buy health insurance. Instead, what the ACA did in effect was impose a tax, which obviously the federal government has a taxing authority, and that tax would be linked to whether or not you have health insurance. And so it passed constitutional muster the first time around. The challenge is, and the reason that California versus Texas is back before the court, is that subsequent to that, a Republican-dominated Congress didn't repeal the ACA. That didn't happen, as we talked about, too popular, or at least some provisions of it are too popular. But they did repeal the tax. So without the tax that was the basis in the Roberts construction for why the ACA was constitutional, if that's no longer there, the logic goes, well, the entire law should be repealed. Now, the argument on the other side, I think, is, to me, a more convincing one, and to, I'd say, at least 60–70% of the lawyers that I talk to who know this kind of area, and you guys have probably thought about it a lot too, is that if Congress had a chance then to repeal the whole law, that they most expressly did not do that, and they had some discussions about continuing these other provisions and so forth. And not only that, a lot of these provisions, like Medicaid expansion, aren't really directly in the CMMI, the Center for Medicare and Medicaid Innovation, not really tied to the individual mandate anyway. So that would be a really extreme step to take that Congress clearly did not intend to do. So that's the argument on the other side. But this is a live issue with now a nominee who's been pretty skeptical of these kind of broader interpretations, and Justice Roberts, Chief Justice Roberts' original 2012 interpretation ahead of the implementation of the law. So this is something you're going to hear a lot about in the next couple of weeks. It's, I think, the Democrats have decided a better election issue for swing voters, especially, than talking about abortion and so many of the other areas where the makeup of the court would matter. Just because the hearing occurs a week after the election doesn't mean that we're going to all of a sudden have a lot of action, though, related to either defending or doing something to respond to the potential repeal of the ACA. It's going to be some months before the court issues an opinion on this case. And in the meantime, we're presumably going to have a new administration, either the next administration, whether it's Trump or Biden, gets started in January before there's any opinion. And remember, the highest priority things that the candidates are running on now, things like getting the economy back on track and in some version of responding more effectively to the pandemic, especially if Biden's elected. So that is where a lot of his political, if Biden wins, that is where the bulk of his political capital is going to have to go. Now, if there is a real repeal for the ACA, the foundations that are being laid now, the things that people are talking about, what you would do to maybe reinstate it in some form, that will all get debated and discussed again, but probably not until, it's more like spring 2021, assuming things even get to that point. If not, if the Supreme Court does uphold, for all practical purposes, the bulk of the ACA, it doesn't seem very likely to me that big time coverage reform and expansion is going to be a top issue in 2021, based on how the election is going so far. Not because it's unimportant, but because it's expensive, because it's divisive. People do vote on it, and they tend to side with whoever is defending, not disrupting, your relationship with your doctor, the way you get coverage now, and so forth. So it takes a lot of political capital to win on the issue, and I think they're going to see a lot of the Biden capital, if he's elected, go to economic recovery, stimulus, things like that, and COVID-19 strategies. If Trump's reelected, probably more on economy and not on coverage. Maybe people hold him to turning his executive orders into something that can actually be implemented effectively, maybe, but probably not a big year for healthcare, for major health insurance expansion. So with all of that, we wanted to, by way of framing, we wanted to turn to you all. And I'm sure you've got opinions and maybe somewhat different views than I do on some of the issues that I just went through. But that's what we'd like to get to for the rest of our time together. And Karina, I see I went over by a few minutes. My apologies. Hopefully we've still got some time for discussion. If you're
great.
there.
Thanks, Mark. So I think we're going to take probably the next 15 minutes, if Yeah, let's go for around 12, 15 minutes. Risha, if you can break out folks into small groups, and just given all that Mark just discussed, kind of yourselves, what, even though we might not have any kind of major reforms in terms of coverage, kind of what opportunities have the recent months presented with COVID and all else to reform healthcare. So we'll give you guys, like I said, like 12 to 15 minutes and then come back for discussion.
Okay, I'm gonna break everyone out into 5 rooms. That puts about 4 to 5 people in one room.
And then after that, it's been masks, distancing measures, debates about how much emphasis we put on reopening in the short term versus continuing to try to control spread, how much we need to invest in testing and supporting systems, and the fact of the matter that people who are from minority groups, lower income backgrounds, are just at intrinsically higher risk because of their jobs, where and how they live, all kinds of things that do go beyond healthcare. And I think it's those parts of the response. Yeah, healthcare, coverage of your coronavirus test cost and coverage of your COVID complications. Those are important, but it's really focused more on these kind of sort of short-term issues where people differ, and where Trump has certainly left some room for criticism compared to in terms of U.S. performance relative to the rest of the world, and ability to control the outbreak and get the economy going safely again. So that's really what, and basically for the people who think that that's a big deal or that's their number one issue, they're going to vote for Biden, and so that's why he's focusing on that issue.
Does anyone else have any questions or something else that they might want to share?
I'll share one quick thing that we talked about generally in our group that I think, Mark, you touched on during your presentation, but I wonder if in terms of public opinion, if just like the general appetite for social programs has gone up during the pandemic. Like we were talking about how Arkansas expanded Medicaid over the summer. And I mean, not that that wasn't already going to happen with, they had a really big campaign around Medicaid expansion. But just in terms of, health plans and campaigns around social drivers of health that are increasing, and more people just needing support paying for their health care, that there might be more people who want a public option now or who want Medicare for all now than did previously if they've lost their employer insurance.
Yeah, I think no question in like some states, that's an issue that Governor Cooper is running on here in North Carolina. Just a reminder, hey, I've been pushing for this for 4 years. Let's do it. It's one thing for like a state candidate who in a state that hasn't expanded Medicaid yet to get enough political leverage to push that over the line. I do think even that's going to be challenging because of the economic condition that states are in, that states are going to be in next year. The federal government can potentially make that better. Remember that one of the most popular things that states want during a recession is an increase in the federal matching rate for Medicaid. So basically the share of Medicaid that the federal government pays goes up. Why do states want that, Republican and Democratic states? Not necessarily because they want to spend it on Medicaid, but basically they've got the cost of the program that they're facing, because Medicaid also has requirements for what you have to cover. It's an entitlement. What that does is essentially reduce the amount of money that a state has to put into it that could then use for other things. As they could use it potentially to expand Medicaid, do something else with coverage. They could use it to fill in gaps in the shortfalls that they're going to have in education and in unemployment. And other social benefits with the economic downturn. It's a lot of other places that could go. And given all of that, and given that economy, COVID are the top issues, I do think that first thing for Biden is going to be some kind of stimulus package that includes giving a lot of money to states, that includes giving additional unemployment benefits, maybe some expansions, temporary in health coverage that people might want to try to make more permanent, some other jobs programs to help industries that have been hard hit. And, even though it seems like something that both sides should be able to get behind, we've just seen over the last 3 months, where parties, they're both for COVID relief. They're just for different versions of it. It's going to take some, if we've got a fairly closely divided House and Senate, even if Biden gets rid of and the Senate gets rid of the filibuster rule and the Democrats have the majority, it's going to take some leverage to get there. If the Republicans hold the Senate with the Democrat president, it's going to take a lot of leverage to get there. So that's probably that, and COVID response are going to take you through the first at least 50, if not 100 days. And remember how big of a lift Obamacare was. And we're talking about like an incremental, important, but an incremental expansion of Medicaid and coverage for this, 10% of the population, important percentage, that didn't have coverage of their jobs and wasn't eligible for Medicaid. So Medicare for All is a lot bigger deal than that. People remember how Obama got hit over not being able to keep your plan. So public option is, your first talking point there is if you like your plan, you can keep it. And in addition, here's a new option for you. I think that's going to be the direction, given that Sanders did not win. If you look at polling on Medicare for All, even now, it's not great. And if you call something Medicare for All, it actually that name doesn't poll well. There are other names that poll better. We should talk about this some other time. But I think it's going to be a really heavy lift, and I think you're going to have dealing with the economy, dealing with COVID, coming out of whatever mandate, if any, there is from the election. And then maybe going into having to do, clean up on ACA if the Supreme Court rules by March, April, that some significant part is unconstitutional and therefore no longer valid. That's maybe the ACA, redo the ACA, maybe that's a time to get to Medicare for All. Probably, I think that's tough. In such a divided country. But, everybody should keep trying for the proposals they think would make the most difference and work hard while you're here to learn how to get them right. We're saying in our breakout group, this stuff is complicated, transparency, trying to encourage telehealth, a lot of well-meaning ideas out there, but they can be challenging to implement. So I hope we'll keep working on all of those.
Okay, great. Well, so thank you again, everyone, for coming, and thank you again, Mark, for joining us today. Just some closing things, future dates. We have our next Scholar Skill Lab is going to be October 22nd, same time, 7 to 8 p.m. And our next Journal Club is going to be October 26th. That's also 7 to 8 p.m. And this is reflected on the portal. So if you forget, you can always take a look there. Okay, thank you, everyone.
Thank you all.
Thanks, Mark. Thanks, everyone.